Sorry. So Cleopatra, you've seen, ka?
Yes.
Okay. So now we've talked about the normal atria, the normal capillary and the atria. So you've got the vein on this side. The vein is the smallest vein. The arteriole is the smallest artery. And then you've got the capillary in between. So we are saying that hyperemia is an active process. What happens is that under hyperemia, there is vasodilatation, there is an increase in the diameter of the blood of the artery, in short, the smallest artery. So what happens is that since there is that increase in the diameter, there will be also increase in the blood flow towards that tissue. And it will look reddish. Exercise leads to that, inflammation leads to that. And then you talk about congestion. You're saying this is a passive process. It's a passive one. And it's due to what will happen is that the outflow, or let me just, the outflow of the blood is the blood vessel is occluded or is obstructed, meaning that the blood won't be passing through that tissue. What will happen is that the blood will accumulate from this side. So blood will accumulate from this side. There will be blood. There will be blood. While here the blood will be passing, but it will be more on this side, and the blood will be a lot coming this side. That is why it is looking reddish. So now let's talk about what's this. Let's conclude about these two, the hyperemia and the congestion, because these ones they will come in your paper. So chronic congestion means that this congestion is taking time, and it has taken time. So what will happen is that you are going to have less venous pressure, meaning that the pressure in veins will be high. And that is very straightforward because you can check from the diagram, from the way I just explained. Is this now? So from the way I explained it, these two diagram. These things cannot move. Page part work. Okay, I get it now. So now the point is that under congestion, what is happening is that there is obstruction here, meaning that the venous will be obstructed, meaning that the venous or the blood flow in the veins will be disturbed. That's what they mean when they say raise the venous pressure. The pressure will increase because there is too much blood coming this side. There is too much blood and it is congested. It means that the pressure will increase that side. Okay. So there will be anoxia, meaning that there will be, because it's congestion, meaning that there will be no reaching of blood that side, and there will be no oxygen supply to that tissue. There will be metabolite accumulation because you need oxygen for those metabolic functions to occur. Okay, so there will be parenchyma, atrophy, degeneration, necrosis, and also other stuffs. There will be edema because we are saying that the blood is just coming and then the blood is being occluded in here. So what will happen is that the blood will start moving now into the parenchyma, into the interstitial spaces. We are going to have edema and increase in that edema will be caused by the increase in permeability because the blood is just coming. It is not moving to other tissues. It is just remaining that side. Okay. So this is also a summary of everything we talked about. So now let's go back to the edema. So we talked about this last time. We said that edema is just the accumulation of fluid in the interstitial space. So we said that what happens is that the normal is this. Pay attention to the normal, because if you don't understand the normal, you'll never understand the abnormal, and you won't understand the pharmacological, the therapy. So this is the normal. This is the normal now. So this is the normal flow of the blood. What happens is that we've got two major forces, like we mentioned last time. We've got what we call the osmotic pressure, or what we call the hydrostatic pressure. So the hydrostatic pressure is this side. This is the hydrostatic pressure, and then we've got what we call the plasma oncotic pressure or plasmacoid pressure. We talked about this last time. Physical. We had the physical lecture about this. So this is called the oncotic pressure. Oncotic pressure. Oncotic pressure. So these two pressures are also this is disturbing. Anyway, remove. My page people are tracking. Okay, so we've talked about the two pressures. We've talked about the hydrostatic pressure and the oncotic pressure. So now you have to understand it in this way. So that, yes. So you have to understand it in this way that we've got two pressures, the oncotic and the osmotic. The osmotic is also called hydrostatic pressure because it is provided by water or the fluid that is inside the blood vessel. Wow, the oncotic pressure is the pressure that is caused by the proteins that are in the blood, because we mentioned that the blood itself is made up of proteins and the fluid. The fluid part is made up of plasma. The plasma has got different types of proteins. We talked about the albumin, we talked about protein factors, and we also talked about other proteins, globulin, that are found in the plasma, making the plasma. And then we talked about the fluid. We said the fluid is made up of two things. I mean, the suspended elements, aka the cells of the blood. We talked about the white blood cells, red blood cells. We talked about the platelets. So all those things are part of the blood. Now we are saying that what provides the oncotic pressure is the proteins that are found in the blood vessel. So remember, let me tell you the gimmick that is there. Just understand that, for example, if you have glucose in your blood, what happens is that glucose is osmotically active. So it pulls water. It pulls water or fluid. So let's assume you had glucose in here on the plasma oncotic pressure or oncotic pressure. So those proteins that are this side, they are the ones that are pulling water from the outside, putting it inside, so that it goes into a secretion. So what provides that is called the oncotic pressure, and what provides those things is, that force is called proteins, or the proteins are the ones that provide that pressure that is there, the oncotic pressure. While the hydrostatic pressure, from the word hydro, means water, or osmotic pressure, this one is provided by the fluid that is in here. The fluid will push the fluid going into this side. And what happens that when the fluid enters into the interstitial space, it is supposed to go into the capillary, the lymphatics. The lymphatics will carry that water or the fluid, take it to the thoracic duct. From the thoracic duct to what we call this left subclavian vein. That's why this thoracic duct drain into. So it drains there in the left subclavian vein. For now, understand that this is the normal physiology. This is what happens, and this is what is happening right now. The fluid in the arterial, on the arterial side, this side, because this is an artery, so it's called an arterial. The fluid will push that fluid to go into the interstitial space, and then the fluid will be absorbed. It will diffuse into the lymphatics, and then the lymphatics will take that fluid and take it outside. While the oncotic pressure, there will be some fluid that will be released, that will remain in the interstitial space. So what happens is that the plasma, the proteins that are there, they will be pulling. They'll be pulling that fluid that is in there and put it back in the in the plasma. So now I want you to understand that these two forces are supposed to be balanced in order for everything to take place. Okay, so everything is supposed to be, these two forces must be balanced so that the blood flow continues in the normal manner, or we maintain the integrity. If at all there is an imbalance in any of these two forces, you are going to have what you call edema. So let me show you something. If at all, for example, something happened, so anything happened, for example, this force, the hydrostatic force increases like above the norm. What happens that the fluid will be pushed into the interstitial space. Okay, it will be pushed into the interstitial space, and that will mean that there will be an imbalance between these two forces, and that will lead to edema. Because we are saying edema is the accumulation of fluid in this space, in the interstitial space. So now, if you increase the force that is pushing water outside the blood vessel, that will lead to edema. And then if you decrease the oncotic pressure, that is putting the fluid, if you decrease it, you are going to have edema. Because what will happen is that the other force will be balanced, but the fluid that will be put into the oasis will be in a little amount, and some fluid will remain there in the interstitial space, so it will cause edema as well. Now let's assume we said that the fluid is, the normal way is that the fluid will go into the lymphatics. From the lymphatics, the fluid will be taken to the subclavian vein. So now, if there is an occlusion here, meaning that the fluid won't be taken to the left subclavian vein to accumulate in the lymphatics, and that will also lead to edema, and it is called lymphatic obstruction. So they can ask you to state the oasis, the causes of edema. We've talked about increased hydrostatic pressure. We've talked about decreased oncotic pressure or decreased plasmacroid osmotic pressure. And then third, we've talked about the block or the occlusion or what we call lymphatic obstruction, because this one is supposed to take the blood to the, it's not certain. So this one is supposed to take the blood in this direction, the fluid in this direction. Now, if it has been obstructed, meaning that integrity, the flow has been disturbed, so that the fluid will accumulate in the ear, and then you are going to have the fluid which will remain in the interstitial space and form what you call edema. Okay. So now, two opposing major factors governing fluid movement between the basic and interstitial space. I've talked about this. The diagram explains everything. 4. Sodium water retention. Sodium water retention. What happens in sodium water retention is that, let me just tell you the theory that is there. Wherever sodium goes, water follows. Now there is something that happens under in the water.
Akiambo J na futi